here with Rachel again. We are going to be continuing to talk to her about her story with her daughter Ellie, who has PRS, and their experience with mandible distraction or jaw distraction. So stay tuned. All right, we're going to move to questions. Let's see. And some of this we talked a little bit, so we'll try to answer in more concise ways. The biggest one is, why were there different recommendations for each of us?
That's a good question. I would say the sleeping would be a big one. The fact that you guys were able to adjust with positioning would be huge.
So my understanding, and usually what I tell people, is that it varies just case by case, because airways vary case to case.
Exactly.
Severity varies case to case. And if you did listen to the whole thing, you'll notice that there was a difference in car seats. Ava was able to do in a car seat, but you had the lay down car seat. There was a difference for us, and we had the same ear, nose, and throat doctor who looked at Ava's case when there was a camera down her throat when she was under, and said, TLA will solve this. And for you, when pushed a little, he was like, visibly this looks like cases where the TLA may not solve the problem.
Right.
So, and I will say, I think, and my understanding is that there are also variances between surgeons and surgeon preferences. I do believe that the jaw distraction or mandible distraction is relatively new. Like you said you thought it was last 30 years?
Yeah, it's about 30 years ago.
It's
30 plus, but in the early 30s.
And I was told, and don't ask me to find a source because I don't know if they can. This is just what I was told, and now I forget who told me. But I was told that you have to take special training to do a mandible distraction. There's a lot involved, and of course it's resculpting bone, and so it's not an option everywhere. And like we said, because airways vary, there is the risk that a TLA will not solve the problem. And that does get tricky for individuals where either jaw distraction is not offered where you're at, or you have to fly somewhere to get it. There is the possibility that you could have the tongue lip adhesion and it doesn't solve the problem, and then you're looking at needing to go find a way to do a jaw distraction anyway. And then of course, and this is something that neither one of us have the personal experience with, tracheotomy is an option as well. And so if you're in a place where your doctor isn't trained in a jaw distraction, they may be looking at either TLA or tracheotomy. And if they can't transport the kiddo, ultimately the importance is that they can breathe. And so then the trach might be the right solution. So there's a lot of things that I think go into it, and I think it's hard to say definitively, like, this is why one case versus the other, except for the signs like that we've been talking about, like the distressed breathing, like that we can't safely send you home from hospital. Ava was able to go home for a little bit with positioning, so take all of that into account when you are looking at your individual cases as well.
Yeah.
Did you want to add anything? I know I just kind of word vomited, so.
No, it's fine. I know for us, the phrase I would use with doctors is, what would you do if this was your own kid? Or what is your gut intuition telling you?
Yeah.
Because they see it every day.
Yeah.
And some doctors will answer that and some won't, and it's totally fine. But that one helped me, because I didn't know what to do in that situation with our kiddo. And I really wanted somebody who sees it all the time, especially someone who had gut intuition, to be like, you know what? I can't even tell you totally why you should choose this one, but my gut's saying this one. And if you have that, that's just icing on the cake to help you make the decision.
There are two other questions that we'll do. One, what were we told about the risks of either surgery? Because it does seem to vary. So for me, we were definitely told that the TLA may not work. And that while it is less invasive, you do run that risk where you could go through that 6 days where you can't talk, then the healing period, and then find out that it hasn't solved the problem and you have to go in and have an additional surgery.
We were told 20% chance
Okay.
of it not working.
Okay.
So, and that stuck out from us because we did hear she's a strong candidate for that 20% fail
Yeah.
rate. So that's why I remember so well
Yeah.
the 80-20 ratio.
So risk for mandible distraction.
Yes. One of the big ones, of course, you're going in with a surgery where they are going to be cutting, into their throat. So you do have to sign a blood transfusion form, and which is intimidating to sign that for your
Yeah.
baby. But absolutely, it was necessary. It was no big deal, and it's
Yeah.
our doctors never needed it, but legally she did. Of course, she does have to
Yeah.
have us sign that. The other one is partial facial paralysis.
Mhm.
That is a risk. I don't remember the percentage on it,
Okay.
but I know it's pretty high because all of these muscles are getting cut.
I know
and-
that was like a big worry for us, and I'm sure
Mhm.
part of it was because they kept telling us it was on the fence and she had been doing okay with positioning.
Mhm.
So at that point, choosing something that may have
Yes.
facial paralysis for us was
Yeah.
and because my husband had PRS and his jaw grew in naturally over the first year,
Yeah.
my gut was that was going to be the case for Ava. So I was like,
Yeah.
do I want to force the chin in first,
Mhm.
if I don't have to?
Yeah. And it can go too far
Yeah,
because they
that's-
crank it
yeah.
forward. And what if you have big chins? And all of a
Right.
sudden now you're having to do more corrective
More surgery
surgery.
because
My husband and I have small chins, so we were willing to run that risk.
Okay.
Because we're like, it's not,
Yeah.
I don't think it's going to grow that big. But so the partial facial paralysis, and there is a picture that
Yeah,
will be up.
we'll put it over the top here.
Yes. So you can see one side of Ellie's face does have it. For Ellie, it's a mild case. It comes up when she cries, and it comes when she smiles really big.
Okay.
Her Piero Man smile. When she does that, you see it go a little crooked. It's adorable, and it is probably going to be, as she gets older, something she can correct by learning how to smile in the mirror.
Okay.
There are corrective surgeries she could do.
Okay.
We will, for ourselves, it's not severe enough that we're going to do them.
Okay.
That will be more of when you're 18, if you want
If
to
you want to.
voluntarily do the surgery for yourself,
Mhm.
go ahead, but I'm not going to put her under it.
Yeah.
But yeah, honestly, if she looks in a mirror, she'll be able to correct it, at least for her.
Okay.
But it does vary because there are some that have more severe facial paralysis that will need follow-up surgeries just to repair that.
And you said you don't remember the percentage likelihood of that. 'Cause there's just so many nerves in the face.
Yeah, it was higher.
Yeah.
I'm just throwing a number out there. I want to say it was 25-30% chance.
Okay.
I mean, it's a decent chance, and it might even be higher than that.
Okay.
I might be lowballing it.
Okay.
So, and it can, like I said, vary in severity.
Okay.
It might not happen to kids.
Yeah.
It might. There's nothing you can really
Yeah.
do to stop it. It just,
Well-
at least at this point where our technology is.
Well, and it's hard because at the end of the day, you're breathing is more important than an even smile. You know
Yeah.
what I mean? But I do remember even the TLA, and this for TLA was a little irrational, but Ava, because we waited till she was 6 weeks, had just done her first smiles. And then I was going to put her under surgery, and I was like, what if she doesn't smile anymore? Which is not rational, but I
Right.
remember having
Because that won't
fear.
happen with TLA. That will happen.
Right, but same thing with I can't imagine going into a mandible distraction. Early on as well, but this
Yeah.
idea of I'm influencing
What
how
their face will look
what
like.
their face looks like. That's a huge.
Yeah.
And again, you can be afraid of that and worried
Yeah.
about that, but at the end of the day, you're but I want you to breathe more.
Yeah.
So,
Yeah, it turned
Yeah.
into this is what's healthy and best for you, and your survival is far more important than a slightly crooked smile.
Yep.
Because that can be corrected later.
Yes. Well, and
And-
I didn't know it could be corrected later, so that's
Yes,
helpful.
it can.
How about any additional risks that we were
Scarring.
Okay.
So the scarring, it looks like little dots on their chin when it first surgery first happens to baby, maybe 1/4 of an
I'll
inch.
put a couple pictures up.
And yes,
Yeah.
and then I have pictures of Ellie as well with these surgeries. And then the 1-inch scars where the hardware went in, when they become adults, plan on 4-inch scar for the neck and a 1-inch scar under the chin. And that really made us nervous because we're like, oh boy, that, I mean, you can sort of hide that with makeup, but gosh, that's a lot of scars on our kid's neck.
Yeah.
And so that was a tough pill to swallow with that one. And our surgeon did say it's actually not going to be that bad. I know it's long, but it won't be that bad.
Yeah.
The nice thing is, having now Ellie being 2 years old, I can say she was 100% right. It's not that bad.
Okay.
I mean, the wrinkles,
That's
yes, the scarring that's here, and when you put those pictures up, like you're gonna have to focus to try to see where her scars are, and a lot of times you still can't see them, because it's right where her creases are. So you just see neck crease. So there's that one, and then her chin ones. These actually look like chin dimples at first, like it looked like dimples, but right here. And that was part of that scarring, and so when we kept massaging it, it helped smooth it out, so that chin dimple is mostly gone. I'll still see it when she like makes her little double chin of sass. I'll go, oh, there's your chin dimples. But so they're still there a little bit, but not much. But yeah, so that was definitely something that was such a big deal at the time. But now having my 2-year-old, it's not.
Yeah.
Honestly. And it's everything is under the chin line.
Yeah.
So as a teenager and as an adult, no one's going to notice it.
Right.
Unless she looks like off to the side and someone will go, why do you have scars?
Right.
But then it's just a cool story to tell.
Right.
So
I feel like the first year is so stressful, and there's so many major decisions and so many fears tied to these surgeries. But once you have the gift of time and it's been long enough, it's actually okay. Yeah.
After she healed from that third surgery, we breathed. And I got to begin again. I felt like, okay, this is my moment. Now I have my baby. Yeah. And we got to live life without having to have a mental countdown to the next surgery.
Right. Or even all the doctor's appointments and follows up. And
now it's annual, and Ellie's doing so great. It's actually going to every couple of years for some of them.
Awesome.
And something that's interesting, since you were able to go home, I'm just going to throw this out there. Ellie did not need occupational therapy. She was ahead on everything.
So interesting about Ava's large motor stuff is I actually don't think it was tied to PRS necessarily.
Okay.
My mom said that a lot of people on her side of the family didn't walk till later, like 18, 20 months. So everything is all tied together, of course, and I'm sure having, 2 months where she couldn't move very much affected that, but I don't know that is why.
Okay, that's interesting. But yeah, because I know what we were told is just statistically, when you have a NICU stay that's longer than a week, there was a few things we were warned about. Baby usually doesn't sleep well through the night, even as they get older. Ellie is 2 years old, and honestly, she wakes up at least once a night, at least 5 days a week. And it's exhausting. I'm ready to sleep, and she wants me to go in there and sit with her. But they were right. We got that warning by multiple doctors and by nurses, and there's no reason for it, but they're like, something about NICU babies that are here longer than a week, they have an increased, sleep disruption, whatever that phrase is called. But yeah, Ellie is over 2 years old now, and still 3 to 5 nights a week minimum she's waking up, and it's very rare to have a 3-night week.
Did they say that eventually evens out, or just is what it is, kind of lifetime, or?
I think it eventually evens out, because they did tell us, they're like, it can go several years, so don't be upset.
Indefinitely.
Yeah, I don't think there was anything about like you have an insomniac now.
Well, I mean, it could happen.
Right, yes. So you don't have to be scared of that, but you also don't have to be frustrated if you're watching this video and you have a child that's 3 years old and you're like, why are you still waking me up?
Yeah, it should hopefully even out soon.
Yeah. So
I'm trying to think any other risks I feel like those are the big ones. For me, what was scary about jaw distractions were the facial paralysis, and then the amount of jaw breakage and
it sounds so intimidating. Yes. Like, wait, you're sawing their jaw off their face?
Yeah.
But it was for Ellie, it was wonderful because that chin was just so far back. Yeah. And there's going to be a before and after picture as well that you guys can see, and it is crazy. what
Well,
she looked like before to after.
And I hear that all the time, that like people are very much like, this is the best thing that I did for my child. So I think,
and both of them were great.
yeah,
There's really
yeah.
not one or the other. It just depends on your individual child, and that's the
Yeah.
hardest part. Is you wish there was
Yeah.
an answer of, at this point we always go this way,
Yeah.
and it's just not that black and
Yeah.
white.
So let's do I think there's one, maybe two. Okay. So last question. What are the main differences between the two surgery experiences? And this is just going to be a kind of a summary of what we've been talking about. Length of hospital stay, post-care differences, follow-up surgery differences. And then we will say how our kids are doing now, but I think we've already kind of answered that. So length of hospital stay for the TLA was about, I think, 10 or 11 days total. So like a week and a half, close to 2 weeks. And this was with Ava after going in after she was 6 weeks old. So it doesn't include any NICU stay or any of those times. She was sedated as she was healing for 6 days.
Yeah.
But then after that was out and she woke up, they had the button on as she was healing a little bit more. They made sure she could eat for a couple days. And then we could go home. And there was, for the TLA, really no post-care at home, which I know is a huge difference. And then for follow-up surgeries at 9 months, because 9 months is when you need your tongue to start making words, we did go in and have the TLA removed. It was an overnight. She just had to be able to eat before we could go home, and she was eating the next day. And then it was like, no thing, like at least for Ava, she was like, okay, well, what are we doing now? So I think those are the big points for TLA. Now for jaw distraction.
For jaw distraction, Ellie was difficult to answer that in the sense that she was born into NICU and then into surgery.
Yeah.
So she had her surgery 11 days after she was born.
Okay.
So at that point, she was intubated from surgery happened on Tuesday. She was intubated until Saturday.
Okay.
After she was extubated, they observed her for 1 week.
Okay.
I've heard it can be shorter.
And that's when they were doing the turns, right?
The turns happened all in that time. Now, some people can actually get released from the hospital sooner than that.
Okay.
And they will train you how to do the crank at home. It's really easy. It is like a screwdriver, and it has a line on it.
Okay.
And you make one complete turn. And you literally go line, wrap it around to the line again. You can't screw it up.
Okay, that's cool.
But Ellie was in there for a full week, so everything happened under the care of the medical professionals,
About
which I prefer it that way.
Right.
It made it easy.
But that was about 2 weeks.
Yeah, that was about
Okay.
2 weeks. Then, a week and a half.
Okay, so similar.
It's very
hospital
similar
stays.
hospital stay.
Okay.
One thing I would add to it, this will help. We were told, because adults will actually still get mandible distraction, they've all described it as when the jaw is cranked forward, it feels like braces, that same kind of ache. So I know I pictured it would be torture for my poor baby. They're like, it's like braces. I'm like,
So
I
uncomfortable,
can do that.
but doable.
Yeah, so that's what we were told. So if that helps answer anyone's questions, if you're really worried about pain level while it's cranked forward, think of braces.
Yeah.
And it's not that bad.
No,
Ellie
it's okay.
didn't mind at all. We coincided her feeding, her bottle feeding with the cranking.
Okay.
And
she
she
was like,
didn't
"All
even
right."
care. Yeah, she didn't even react.
Like,
when
I'm
her jaw
getting
was-
food. I'm cool.
Yeah,
Okay.
we would do a crank here, we would do a crank there, and she just kept eating.
And then you went back to have the removal at 8 weeks old.
Yeah, that was at
and-
9 weeks, although it can happen at 8 weeks.
Okay, so 9 weeks old.
Yeah, that one, the hardware comes out, and the care is much easier because
Then
you're
it's-
just doing wound care at that point.
Okay.
You're not maintaining a site location where the surgery was, and the hardware and cleaning it, because you clean it multiple times a day. I think we were giving Ellie sponge baths too.
Okay.
If memory serves, I don't think we wanted to get her wet in the surgery site. You definitely can't soak it.
Yeah.
So I believe she was sponge baths.
For the second hospital stay, was it an overnight or was it longer than that?
It was overnight.
Okay.
And
so
we went home the
similar
next day.
then. Okay.
Yeah, it was, they want to see the baby's eating properly. and that pain is managed well, and that the incision site is doing okay.
I will say too, like before I forget, we are comparing experiences, but we had the same plastic surgeon. I have heard with TLA, it varies, but like in a scary way, where I've often heard where they've done a TLA surgery and then sent the baby home like the day after. And babies, you can't tell them, don't cry, don't move your tongue when you eat. And so new stitches, a lot of what happens is they pull the stitches out. And
which
then
is why they're intubated. Well,
but that's not like commonplace is what I've been hearing from other people, is that not all surgeons do that. It makes sense to me. Like, keep them passed out so that has time to heal. That's how stitches work, right? You need time to heal. But like, I've heard a lot of cases in other parts of the country and other places in the world where they just sew it and like let them go. So like, ask questions, like find out what the post-care is, because like, just think about it. Even for an adult who you can tell and they would understand, don't move your tongue, you're going to pull your stitches, would be very difficult, especially because you want to talk. It might hurt, you might want to cry, you want to eat. Like, babies, you can't tell them, so they need time to heal, and ask questions, because I think that most of the horror stories that I've heard around TLA is because they don't have that healing time.
Okay, and I know I can answer one just for my perspective, because my question was pain management with mandible distraction. They kept Ellie on Tylenol, and then it's an IV drip of morphine, and that was just for the first couple of days for pain management. But I will also throw in, while she was intubated, her face did swell up really bad. That's the most intimidating part, and I don't have a picture of that. And I will be honest, that was strategic. I remember going, do I want to remember this? No, I don't. And I intentionally didn't take a picture for a couple of days. But she was intubated, so by the time she was extubated, her face was already going back down, and it was, I'm sure, achy and sore and not fun to eat, but it's nothing compared to what she was day 2 and 3. So that was intimidating, but I mean, as long as you're intubated, that is manageable, because yes, her face is huge, but she's not eating.
Well, and Ava for the TLA had swelling, but obviously it's around the site, right? So there was a lot of like big fat lip and then some facial swelling too, just because, you know, it's a lot of sensitive areas in there. So poor little babies, their bodies are so tiny, and so the swelling seems worse.
I think she went up a pound in swelling, and then she lost it all like a week later.
Okay, so we talked the differences hospital stay, and as far as like how they're doing now, I think they're both fantastic, right?
Totally
like,
normal now.
There's nothing really different than any other 2-year-old, except for like yearly doctor appointments and follow-ups, depending on the specialty.
Exactly.
I think those were the 3 main questions, and I made sure to say the thing about the TLA. So I think, unless you have anything else you want to share, that's all. I mean, this is a lot. I think I might cut this up, make it 3 parts. So I just want to thank Rachel for coming. Like, this is such a special thing to happen. Like, one, you don't often get to meet other PRS parents. So to have one locally and to have her willing to share her story is fantastic. So I want to say thank you for coming, and I want to say thank you for watching. We love talking, and hopefully you found this all very interesting and hopefully helpful for you as well. So I'll see you next time. Bye! Ellie, here you go. Yay! Mabel's here too. Oh, Mabel!